Hi everyone, welcome back to another episode of Medical Care Redefined. This is Lan.
This is Dr. Wynn.
And I just want to preface by saying that it has been 5 years since we started DPC Health. So it's been a journey of us, finding what we wanted to do in the groove of medicine. And I just want to applaud Dr. Wynn, as time went on, the medicine that you take on and the type of care you bring on continues to change with you, right?
That's right.
Yeah, and so one of the things is peptides. And so today we're going to talk about peptides and how that has evolved into our membership and how you've been practicing that as well. So let's start off by talking what is peptides and what does it do?
Yeah, so before we even get into this, the reason why I actually got into peptide is because kind of accommodating what our patient needs are, right? So actually a few years ago, a few of our patients called me and was like, Dr. Wynn, I heard about this peptide and it can do this and this. And I'm like, oh, it's probably one of those fad things. And I'm like, but I don't want to just ignore it because my patient, it's really important to my patient. And so I decided to do a little bit more research. The more research I knew, I was like, oh, this is pretty interesting, but then I don't know enough. So therefore, I went to a lot of conferences and kind of really know who's actually the one that can really teach us this material properly. So anyway, I get to really know Dr. William Seed and then the SSRP. Well, anyway, the organization really teach me about peptides. That's when I was like, okay, this is a whole new world to us that is kind of like anti-aging medicine that can reverse aging in a molecular level. So it really perks my interest. So that's kind of why I got into it in the first place. But anyway, what peptide is that it's a chain of amino acid that can signal the body to do certain things.
Right.
So we have a lot of peptides that naturally is produced in our body, but the peptides that now we are using to signal the body to function in a certain ways. So for example, we like insulin, for example, is a peptide. It's been forever. We've used insulin. Insulin, did you know that is a peptide?
No, I didn't.
But it's a peptide that signals the body to take sugar from the bloodstream into the cell, and that's kind of save lives for that. But over time, there's different peptides that does different things, and now we're using a lot of peptides to reverse aging in a cellular level. So that's kind of what it is.
Okay, that's really cool. And so it's been fun to watch you practice peptides with our patients and whatnot. What are some of the common ones that you would say patients should look into and should pique their interest on peptides?
Mm-hmm. So the big one that everybody's talking about is semaglutide and tirzepatide. Did you know that's also a peptide? So before I even understand peptide, I was like, I didn't even know that was a peptide until I didn't realize insulin is a peptide. So semaglutide and tirzepatide, the brand name is Wegovy and Mounjaro. That's a peptide. So it's also a chain of amino acid that signals the body to do certain things, right? So semaglutide and tirzepatide are GLP-1s, so that decreases glucose absorption in the GI tract. It signals the brain, tell our brain that we're full, and that's how people are losing weight or lowering the blood sugar by its mechanism of action. That's a weight loss or a diabetic peptide. And then we got the growth hormone peptide, which is called GHRH or GHRP. And then to break down, some of the names are Sermorelin, Ipamorelin, CJC1295, Tesmorelin. So among those class of peptides, that is the one that signals the brain to increase growth hormone production. So as we get older, we lose growth hormone. And so like in our younger years, when we're growing up in our teenage years, we got a lot of growth hormone, right? So it can grow our bones, our muscles, brain development, all this. And then as we get older, the growth hormone starts to kind of decrease. Mm-hmm. And so therefore, when we get older, we get less muscle mass, we gain fat, and then we have memory issues, and our cells kind of go senescent, meaning it goes kind of lazy. And so because our growth hormones decreased, and so this peptide, the growth hormone peptide, increases its production.
Right.
So naturally increasing your own production of the hormone, then kind of helping you sleep better, help increase muscle mass, decrease in fat mass, and just helping you feel better. Immunity is better. So all that whole pathway, because we have really growth hormone in every single cell of the body. So it's pretty cool to see that peptide in action also.
Yes.
Then the third one that I also use a lot, I like a lot, is BPC 157. So that's a peptide of healing. So this is great for athletes. So people who are like working out a lot. So sometimes they'll do it more regularly, kind of systemically. That is to kind of help with recovery after workout. But for example, to injure their shoulder or sprain or something like that, you can also use the BPC 157 as the peptide to put around the area of injury, and that can heal because what does it do? It signals the body to call healing cells to come and repair, and that's what BPC 157 does. It's a healing peptide.
Hi, everyone. Thank you so much for tuning into our podcast episode. This is just a friendly reminder that our membership is as low as $85 a month for all your primary, urgent, and emergent care needs, as well as personalized services in weight loss and hormone replacement therapy. Here is a testimony from one of our DPC Health family members.
My name is Connie Dupuis. I found DPC because I was looking for a primary care provider that could spend more time with me, because some of my medical history is very complicated, and I wanted to have that intimate relationship with my doctor, and found a couple that were close by because I live about 45 minutes away, but really the website appealed to me. I watched the podcasts and they appealed to me and seemed to really care about the patient, so I decided to give it a try. I have completed some of my blood work for hormone replacement therapy and had my first appointment with that. So I'm looking forward to those positive results with like muscle mass strengthening and energy, kind of combating the fatigue.
I mean, there's so many peptides, right? But another one I think that you kind of look into a lot or have for our patients, NAD, right?
Yeah.
What does that do? What is the function of that?
So NAD is very helpful in brain clarity and memory. So, and if like, a lot of people who executive, like they work a lot, but they don't want to be on ADHD medicine, right? So sometimes with that, the NAD is really helpful for that brain clarity, for the sharpness and alertness. And then also it helps with muscle repair, because the NAD works with the NADH and the ATP pathway to kind of help with muscle contraction, relaxation, and whatnot. So it's actually really good for that also.
That's awesome. Yeah. So there's so many different types of peptides out there that can help with our body functions and what we do in our daily lives. I guess, what is the delivery method of getting peptides into our bodies?
So it depends on the peptide. Generally, most of them are injectables. They're sub-Q. So, for example, semaglutide tirzepatide is a sub-Q injection once a week, and then the growth hormone peptide is generally 5 times a week and then 2 days off, and you usually do it at night, because growth hormone, because this is not an exogenous growth hormone, right? So growth hormone peptide, you got to think about it, is that when we hear the word growth hormone, we always think about like those bodybuilders that inject themselves with growth hormone, and then they have like all these cancers and stuff they get concerned about.
Yeah.
Well, this is like increasing your own production of growth hormone. So it's not exogenous growth hormone. So that means it has to be done at certain times. So the body with growth hormone, it increases release certain times. So like when you're sleeping at night, first thing in the morning, or as midday, or if you want to gain muscle, usually right after workout. So the recommendation I usually will have for my patient who's starting out is to do the growth hormone peptide right before bedtime, and you can't eat 2 hours before and not to eat after, because if you eat it before, then it doesn't, the release is not as good. Okay. And so therefore you do that at night. And the idea of like skipping 2 nights in the week is so that it kind of like restart that receptor, so allowing that receptor to work. And also with the growth hormone peptide, you don't do it constantly throughout the year. It's supposed to be like every 3 months you do the peptide, and then you take a break from it, and then another 3 months you go back. So usually we cycle it twice a year. And the way that the growth hormone peptide work is kind of like, think of it like a car, like you have a classic car in your garage, right? and it sits there. It's like a really nice car, but it just sits there. It's not doing anything. So when we're using the peptide, it's kind of like restarting or like turning on that engine, getting it to tune up.
Yeah.
And then after that, you can leave the car there for a minute, and then it's going to still be functional. But every so often, you have to tune it. So it's kind of like that with growth hormone peptides. Like you kind of like give it a push, but it's still going to continue to be effective, even though you're not injecting or treating yourself like after that 3 month. Does that make sense?
That does make sense. So just to kind of like say it in like normal terms, right? So it's so the peptides really are just having your body like turn on those functions in your body to keep doing what it's been doing, right? And so you need to give it time for your body to even like get used to it and start on its own. So it's naturally that it's going to keep functioning in its own way.
Yeah, so it takes time.
Yeah.
So that's why like they don't say like, oh, I'm not seeing the result right away. Well, it takes about 4 weeks to kind of really
Gotcha.
kick in, 4 to 6 weeks to kick in. But the result is going to continue on even if you're no longer injecting the peptide. So that's kind of the benefit of that.
Awesome. So I guess like because you have all these board certifications, you do more than just family medicine, OVC, and functional. How do you see peptides playing into all of that in the world of medicine?
You know, the truth is I was very skeptical. When I was like, oh, this is one of those.
Yeah.
But, you know, when I actually heard like expert, that's not just like, you know, somebody that's on TikTok or Instagram that doesn't have an MD or doesn't have a credential behind. So like when I actually hear Dr. William Seed and a lot of other expert that with the SSRP organization, like really talking about, they know what they're talking about. And then like, it really makes me kind of like, oh my gosh, this is kind of like the next big thing because we're reversing aging in a molecular level, like natural things. Like you're kind of refunctioning the kind of waking up your own body to function. It's so exciting. Like we don't have to use all these medicines because like that's kind of one of the things with geriatric patients as we get older is like they got like 20 or 30 pills in a bag, and you take this pill because you want this side effects and whatnot. So this is kind of like reversing it, so fixing the underlying problem of aging. So then that makes a huge, huge change into the world of medicine.
Yeah, I agree. And I guess like just to kind of tie it all together, like how would you say the safetiness of it is, and who would be like good candidates for peptide therapy?
So peptide's really safe, generally. Like so, for instance, like I said earlier, it's kind of increasing your own production. So it's not like exogenous growth hormone that you can kind of overdo it. So this one, it's like it's increasing your own, and if you can't make your own, you can't make more of your own. You know, like so it's kind of like that. So it's very safe. Most patients don't have side effects on it. Now I would say though, like for example, BPC 157, it's kind of in like if you have an injury, say for the shoulder, I'm going to inject BPC to help repair, right? So you're going to call these cells to come and repair the tissue. Now, if we have a tumor though, we have a cancer, and you're injecting that peptide into the cancer, it can technically grow that cancer. It's not going to cause cancer, but it can potentially induce it. So that is one thing that I would, you know, be cautious about, right? But generally in a normal, of course, if you get all the screening and you don't have any issues, it's relatively safe.
What about any side effects? Would you say there?
You know, sometimes you get a little side effects. So if like they inject right at the area, they're going to get a little bit of redness, just like anything if they don't clean it as well. That would be the only thing. Some patients will have a little bit of like water retentions because it's a change of cellular moving around a bit. But majority of the time, like I haven't really had any issues with like side effects, or other providers haven't had any of that either.
And then good candidates.
Who's a good candidate?
Yeah,
so I would say like it depends on the peptide, right? So if it's BPC 157, anybody who has an injury, of course, if you're a complete tear, you probably still need to see ortho to kind of sew it up. But for healing, that would be good to use in addition to it. But if you have a sprain or like a minor tear that you don't require surgery, the BPC 157 is great for that peptide. Or if like gut issue, right? So in patients who have gut needed healing of the gut, BPC 157 as an oral capsule can heal the gut. So you're taking it on that. So those would be great patients for that. And then the growth hormone peptides, usually in our patients who start to dip down, usually 40s, 50s, 60s, right? So whenever our growth hormones, and you're having symptoms, right? Tired, fatigued, and brain fog, not sleeping well, the growth hormone peptide would be good. And then our patients who is like already optimal and everything, and like they still cannot lose weight, and they still can't gain muscle and lose fat, that would be growth hormone peptides great. And in our current patient right now, the ones who've lost so much weight with semaglutide and tirzepatide, the issue with semaglutide and tirzepatide, also great peptide for weight loss, with those patients where they just lost so much weight already now, because what happens with that peptide, the semaglutide tirzepatide is indiscriminate of muscle or fat, even though we tell our patient, hey, eat more protein and stuff, but they're still going to lose some muscle with it. So once they get to their weight goal and they need to gain some muscle, what I would do is I switch them over to growth hormone, so like either GHRH or GHRP. So we use a lot of epimorelin, samorelin, CJC 1295. What that does, it kind of helps them gain the muscle but continue to lose the fat. So now they're getting leaning up. So the growth hormone peptide is great for athletes, or for somebody who just want to like have a six pack or like a toned line to go on the beach this summer or something like that. So the growth hormones are great for like those young individuals, but for older patients, it's great just to kind of help them cell function better. Their immunity will get better, sleep better, kind of overall for that matter.
We just want to remind you that DPC Health is available for small businesses too. As a small business owner, you can contribute as much or as little as you want towards your membership for your employees. We also provide mobile services so we can come on site to your workplace whenever you need us to. Let us be your medical team and doctor at DPC Health, where medical care is redefined.
Okay, so just to circle back, right? So if you're already on semaglutide and tirzepatide, you're technically already on peptide therapy,
That's correct.
right?
That's correct.
And so, once you meet your goal and all of that, Dr. Wing can come in and kind of help them like kind of lean up and like get the good muscle mass, right? Because, semaglutide, like you said, and tirzepatide, it's really not targeting just the fat.
Yeah.
So oh, wow. So that makes it full circle in our clinic for all of our patients.
Yeah, absolutely. So a lot of patients come in and say, hey, I've heard that once you start on semaglutide, you can't get off of it because you'll gain the weight back. I was like, if we do it right, and I actually give them ahead of time, right? Like, so we're on this weight journey together. Here are the rules of weight loss. You need to follow this, and we're going to be on the medicine, but I just don't want you to cut less the amount of medicine, amount of food. I want you to change the type of fooding. I need you to eat more protein. But with that journey, still, some patients are still like really difficult to regain that muscle. And so when they get to their weight goal, then we could switch them over to the, say, CJC or the growth hormone peptide to gain that muscle and lean up. And it's just been amazing to see our patient looking so good. And it's exciting to me. Like, I was like, dang, you look really good,
I didn't even know that. That's so cool. Yeah. And on top of that, too, I think I've heard you mention like it could help with testosterone and hormone stuff, too, the functional side of things, right?
That's correct. So in my patient who are on, so some of my male patients or female patients, my male patients who are on, so I have this one particular patient. He was on testosterone and he was already like at that high dose of testosterone already. I don't really want to increase the testosterone anymore, but he was doing pretty good on his testosterone, but then he really couldn't really lose that fat and gain that muscle that he really wanted to. So then he was kind of like tired and whatnot. So I was like, he was a good candidate for growth hormone peptides. So I was like, hey, let's try this. So when you tried it, I saw that his muscle, he gained like 4 pounds of muscle that next month and then lost 4 pounds of fat, and his weight was the same, but like the composition was great. And then I was like, let me just check your testosterone level because we've been monitoring that. Anyway, you saw the testosterone go up even though he was like not changed his testosterone dosage. And so then we actually back off on his testosterone amount that he's injecting. So you don't require as much of the testosterone because that pathway also increase your own production of testosterone.
Okay, and you're able to see all of that because you manage all of that, right?
Yeah, it's kind of
so what does someone need to do if they want to get started on peptides? Do they need a prescription, or how does this conversation start with their providers?
Yeah, so it is a prescription. They probably need to find somebody that really understand peptide. The truth is, if you came to me 5 years ago when we started, I don't know anything about peptides. Now I do, right? But your physician may not understand peptides yet, and they might have been skeptical like I was before. But like finding somebody that really understand it and is comfortable to talk about it, and like not being like, hey, it's really bad for you. At least like opening up that conversation, and then if they feel that you're a fit. then they can write the prescription for you and then get you the right compounding pharmacy.
Yeah.
The problem with the peptide is that people can buy it online in the black market and stuff like that. And so sometimes the quality is not good and it's impurity, so it could be unsafe in that matter. So if they can kind of meet the right physician or the right provider that can write, then get them to the right compounding pharmacy that can make it. That would be safer.
And then how quickly do patients usually see results, I guess?
So I would always tell my patient to be patient because it's a process of signaling the body, right? So it takes time for it to work. So usually about 4 to 6 weeks is when I'll see. So usually I'll start them on it, and then 4 to 6 weeks later I'll follow up, and then we'll do a body composition to see their muscles and all that. So usually we see really good results at that time. And most of my patients say, okay, I'm recovering well on my workout. Some of my patients who are in like their 60s now still doing CrossFit and like regain. So their recovery time is really good with the peptide. So it's just amazing to see results from it.
That's awesome. And I guess like just to tie it all together, like because you're so comprehensive, you do all these things. That's why you want to implement peptides. Like patients should probably find like a similar route, right? They don't want to just jump into peptide and only do peptides, right?
Right. So I think that it's in medicine, it should be kind of like looking at it as all like what is the best thing for this patient. The truth is peptide's not for everybody. So the physician or whomever you go to should be able to kind of look at it all. Like, okay, your primary care needs. Like, how's your diabetes, your hypertension, your basic things, and then what's your weight like? What's your hormone balancing like? Where are you with your overall health, like your sleep and all that. So all those has to play a role together.
Yes.
So you just can't like, okay, I'm gonna give myself this peptide. It sounds great, and I would be like, 6-pack later. No, you got to do the nutrition change, the exercise, like all of it has to kind of come together. So you need kind of like a plan. Like when you go to school, right? We got to have like a plan to do this, and this to get to your end goal. So it's the same thing with our health, is that you kind of have to have a plan in place. And the thing with medicine, it should be proactive medicine, not reactive medicine. Meaning we got to like look at the future and say, what does it look like? How can we prevent you from getting sick? And how can we get you to be optimal and not just like, oh, let's wait till you have diabetes and treat you, or let's wait until you have pneumonia and then treat you. So we want to do all the things that we can to be proactive in medicine.
I guess because you also do so many peptides itself. Like I think there's 9 that you usually typically manage for our patients. Are you able to do more than one at once, or like is it just one at a time? Like what is the goal like for that?
So like I said, it depends on the patient because it can be expensive. You put it all together, right? So I always kind of like, what's my patient's budget? Are they, so let's say if they're going to be on semaglutide, but their muscle mass is really low, I would sometimes put them on growth hormone at the same, like growth hormone peptide at the same time, so that it can gain muscle and then losing that weight. Or sometimes they're in an injury, and so I would want them to heal the tissue. So I would do the BPC peptide for healing of a tissue, and then I can use like semaglutide or tirzepatide for weight loss or something. Yeah, so we do combined it, and there's other peptides for like skin and for hair and all this other stuff. So there's a lot more, and immunity and all this stuff. So it just depends on what the patient needs. Then we recommend certain things.
Okay, that makes sense. Well, happy 5 years, Dr. Nguyen. You've done a great job in the past 5 years. I can't wait to see what you do in the next 5 years. More medicine to learn, and board certifications behind your name, I'm sure. But thanks for telling us about peptides. And if you're listening to this, please like, subscribe, send any comments, questions that you have to Dr. Nguyen, and we'll see you next time. Thanks for choosing DPC Health, where medical care is redefined.